Shoulder Innovations has broken the mold and thought more specifically on how to be a nimble, more efficient, more effective surgical solution for shoulder replacement. As a physician, I'm going to look out for the patient, their outcome, their care, but I'd like to do things economically, and the cost of doing outpatient surgery is 1/2 to 1/3 as it would be in the hospital. The patient is under anesthesia for less time, the staff in the facility have less pressure to perform, and the outcomes are just as good, if not better. The Shoulder Innovations system is a perfect partner for shoulder replacement in the outpatient setting.
Oftentimes when we see failures in shoulder arthroplasty, it's based on positioning of implants, whether it's malpositioned, whether it's poorly positioned. This can be alleviated with enabling technology. If I'm able to see where I want to position it with Provoyance and take that information to the operating room and essentially double check myself, we know from data that better position of implants is better outcomes for patients. Patient engagement is very interesting when it comes to enabling technology. Patients are going to solicit the surgeon and they say, I want the robot. You're going to need to do that, and you're going to need to do it efficiently with a company that knows how to do it well.
Patients want to know about what's going to happen at their surgery. When I show them their three-dimensional plan, they are absolutely more engaged. And a more engaged patient in surgery is going to be a more engaged patient in the post-operative setting, which will lead to a better outcome. Can we finally harness the power of a subscapularis sparing arthroplasty? I mean, that would be wonderful, because then not only have you done more efficient surgery, perfectly timed surgery, perfectly executed surgery, but you've reduced one of the largest complications and sped up the patient's recovery.
If we could get a robot that was a small footprint, did not change the technique significantly, and also did not increase the amount of time in surgery and allowed us to remain efficient, then that would be a win across the board. Utilizing enabling technology that is going to be tied into Provoyance will allow us to do that. It lets us do the entire procedure, so the time of surgery is nothing more than an exercise.
I want to be able to pre-plan, I want to execute. Once I'm able to execute, I want to confirm that I've done everything correctly. This, enhanced with technology, is the future.
What if every room was a robot room because of the small footprint that lives directly on the beach chair?
I want it to be simple, I want it to be portable, I want it to be flexible, I want it to be able to accommodate itself in 3 or 4 operating rooms, be inexpensive, where we don't need a large capital expenditure to offer the most versatile, effective solutions, not conforming to status quo, and understanding what the true needs of the patient and the surgeon are will be our future to success. Eventually, robotic surgery will become part of our lives so that we can streamline the opportunity to perform excellent surgery, whether you do 250 shoulders or whether you do 25 shoulder replacements a year. We can be nimble, we can make changes, we can adapt, and we can rely on the technology to help us make the very best decision.